Good afternoon. Well, it's been a few days since I've been on. I've been a little under the weather. Anyway, I thought I would go over some of the things that you can get if you have diabetes. They're just kind of things that kind of develop after you've been a diabetic for a while. Anyway, um, like I said, I've been a diabetic 68 years, and besides diabetes, I have uh, systemic lupus. I've had systemic lupus right along with the diabetes, so it's made both of them uncontrollable. Um, Over the years, I have developed Hashimoto's thyroiditis, which is also another autoimmune disease. I have developed kidney problems. Um, I have developed mast cell activation syndrome, which is also a autoimmune disease. I have uh, orthostatic hypotension, which is caused by the uh, problems with my nerves. I have a pernicious anemia, which most diabetics develop after they've been a diabetic for about 20 years. I have severe polyneuropathy. All diabetics develop neuropathy at one point or another, and a lot of other people develop neuropathy too. Um, I have uh, autonomic dysfunction. I'll explain that one later. Um, I have diabetic retinopathy. I have um, had 2 strokes, um, partially caused by the diabetes, I'm sure. And so I have a lot of um, odd bone things going on or muscle things that are attributed to the diabetes and the lupus together. So let's start at the beginning. First, yeah, the diabetes and the uh, lupus. Uh, they're just kind of incompatible diseases. About 14 years after I had um, the those diagnosed, I was diagnosed with Hashimoto's thyroiditis. It also is an immune system problem. Um, After I died the first time, I had some problems with my adrenals. They were attributed to uh, my dying, and my dying was attributed to my diabetes and the fact that I uh, bled out when I had my last child. So, yes, and I've been dead. I've been actually been dead 4 times and brought back. So I'm a repeat performer. Uh, I have had multiple surgeries. I sat down and counted them. I've actually had 24 surgeries. Uh, Several of them were because of the diabetes. Um, I've had both of my shoulders have had surgery. Um, it is for an adhesive encapsulitis, and I developed that in my late 40s. Um, the orthopedic that I saw for for that and several other things uh, said that he had found that more than 75% of the adhesive encapsulitis surgeries he did were on diabetic women. Uh, he said about 65 to 70% of the adhesive encapsulitis surgeries he did were on diabetics, men and women. But of the diabetics that he did, the majority of them were women. Uh, he wasn't sure what the correlation was, but in his research and whatever, he had found that that was a big thing, was that diabetic women especially were prone to adhesive encapsulitis. And I had both of mine done, and shortly after I finished physical therapy for the one, we were in a car accident and I split my collarbone. And so they immobilized it. And so all the adhesions came back plus some, and they would not go in and redo it or manipulate it simply because they were afraid they would break the bone again. So this arm, I can get up. This one only goes so far. So it is what it is. You deal with it. Uh, I don't think my horseback riding and being thrown off all the time and all the stuff I did cows and stuff did much to help with my back. Uh, Most of my back has been fused. I have a few vertebrae in the thoracic area that have not, but everything from uh, the top of my spine from C1 to T2 have been fused, and from the bottom of the last thoracic down to uh, the last sacral have all been fused. So I'm just fused. Some of that can be attributed to the diabetes, most of it probably to the horses and the lifestyle I led when I was younger. Um, the mast cell was diagnosed in 2010. Um, it was explained to me as the mast cells are the cells in your body that tell your body what to do, your heart to beat, your brain to work, all this kind of stuff. Anyway, the doctor said mine was giving out mutant directions. And at that point, I said, "Oh, that makes me a superwoman." And he goes, "What?" And I said, "Well, if I'm giving out mutant directions, I must be a mutant. And that makes me a superwoman because, you know, all the mutants are super people, like Iron Man and uh, Captain America and Wonder Woman." And he said, "Yeah, if you're going to look at it that way, that works. And I can tell you what your superpower is." And I said, "Ooh, goody, what?" And he goes, "Your ability to confound the doctors." And I guess I'm really good at that. Uh, I have, so things work that way. The pernicious anemia I have had for about 35 years. Um, you don't absorb the B12 through what you eat, and so you have to take B12 shots. I have been taking a B12 shot for once a week for 35 years, or once a month. And in the last 2 months, 3 months, I have increased it to once a week uh, to see if it can help with the autonomic dysfunction. Now, the autonomic dysfunction was explained to me as the nerves in my body are dying, uh, side effect of the diabetes, and the length of time that I've had it. Um, the diabetes can cause it, but then again, so can the lupus. So I have two reasons to have it. I have very low blood pressure. This morning when I got up, it was 83 over 40, and the pulse was 98. So I have been having a dizzy day again today. Therefore, I fit into the dizzy broad section. Um, it's come up. I was 106 over 50 a while ago, so I've come up some, but I've drank a lot of water and ate a lot of salt too. Those are the two things that they recommend that you do because they don't have a pill that can bring your blood pressure up. So I drink lots of water and eat lots of salt, something they tell heart patients not to do. So I have also been told that eventually the nerves to my heart will die, and that is probably what's going to kill me. Uh, it is what it is, but like I said, I've been dead 4 times already, so it's not a big deal anymore. I know where I'm going. I've been there, and uh, I also have orthostatic hypotension, which uh, showed its ugly head about um, the same time that I was diagnosed with the mast cell. Um, orthostatic hypotension, when you uh, get up first thing in the morning and you sit on the edge of the bed if you're a little dizzy, and so you sit there for a while, and then you stand up and tip over, or you stand up and you have to grab onto something and stand there for a few minutes before you take off, you probably have orthostatic hypotension. And you can say something to the doctor, they can check it. It's very easy to check. They lay you down, they let you lay there for a few minutes, and then they check your blood pressure. Then they have you sit up, and they have you sit there for a little bit, and they check your blood pressure, and then they stand you up. And most of the time, they can tell you just from that you have orthostatic hypertension. Like I said, I've had that since it was diagnosed in about 2010 as well. Um, the I've had kidney problems since I died the first time back in 1972. Um, I got an infection from the catheter that was in after I had died, and it didn't show up for a while. And when it finally did, my kidneys shut down completely. So I had a couple of months of dialysis, and I told myself I would never do that again. I've been told that they've greatly improved the treatment, but I don't think I want to do it again anyway. Um, I my kidneys have worked fairly good. It's just like uh, after a couple of months of dialysis treatments, all of a sudden my kidneys started working like they're supposed to. I went through a lot of kidney infections or bladder infections for probably about 20 years, and then they just stopped. And my kidneys, they kept saying, well, we don't understand, but you're not stage 4 kidney disease anymore. You're back to stage 1. And here in the last year, I seem to jump around. I'll be stage 1 one day and stage 3 the next, and then stage 2, and then stage 4. I have not been feeling good the last week or so, and I've gone back to stage 3. Um, I watch my diet. I have a problem with my potassium now. When I was younger and when I was pregnant, I never had any potassium, and they were constantly giving me potassium. And now I don't have any sodium and I have lots of potassium. So I guess that's something you need to keep an eye on as well, because if you have too much potassium, it can kill you. Because every time I get uh, above a certain range, I end up in the hospital. So you have to watch your potassium. I'm on a low potassium diet. That means they took away my broccoli. I love broccoli. They took away a lot of things that I like to eat. So it is what it is. And I told you about my hands. I've had trigger fingers on all 10 fingers twice. I now have Dupuytren's. Um, you see where all the the tendons are all drawing up. This hand is more curved than this one. This one's a little straighter. But I broke this hand too, so that doesn't help either. Um, they have surgery for the Dupuytren's. They also do injections for the Dupuytren's. They won't do the injections for me because I'm allergic to everything. Um, and that's a side effect of the mast cell activation syndrome is uh, you become allergic to things. I am allergic to, at this point, um, 67 of the current drugs. And if you add in the drugs that I have been allergic to over the years that they no longer use, I'm allergic to 89. Um, so they can't even go back and pull up old ones and use them. Anyway, that's a side effect of the mast cell. Uh, I can't say that just because you're diabetic and you've been a diabetic for a long time that you'll get any of these things. Uh, but I can say so, I've known people when I was teaching diabetic classes. I know of diabetics that were diabetic for 2 or 3 years and had kidney problems and liver problems and neuropathy right away. Um, I think part of it, I can't really say that you have to be well controlled to skip all these things, because I skipped a lot of these things for a long time, and I've never been controlled. I don't recommend it. Um, it just seemed like the diabetes and the lupus together just didn't make it so that I was easily controlled. I've always been a very volatile juvenile diabetic. I think they've gone around and changed all the vernacular for diabetes like they do everything else. Just like they changed the normal parameters, which I don't agree with because I don't know of anybody who's diabetic or otherwise who functions well with a blood sugar between 70 and 90. Uh, when I was first diagnosed, the normal for a diabetic was 90 to 110. When they came out for metformin, the drug companies got the parameters lowered to 70 to 90 so that they could get more people on metformin. I don't recommend metformin either because it kills organs that you don't need to have dead. Um, that's just my opinion. So I have diabetic retinopathy. Uh, I have had multiple bleeds in my eyes. When I first started having bleeds, they would treat them with a laser because I can't take um, the eye drops, the numbing eye drops. They did them without anything, and it was kind of like getting popped with a rubber band. It didn't hurt really. It just startled you when it popped. Um, it, in the last few years, they've stopped treating them with the laser. They just kept an eye on them and made sure that the blood was reabsorbed and that the tear didn't get any bigger. Right now, I have a swollen retina in my left eye, which is being treated with prednisone drops. Uh, the doctor said that if this didn't work, that they would go in and put an injection in my eye, which I told him I wasn't going to let them do because he said, well, you can go blind. And I said, then I'll have to go blind because I don't want anybody coming at my eye with a needle, especially since you can't numb it. So we're kind of in a standoff there. And he told me I was about 75% back to normal and I'll be on the prednisone drops for another month or so. We'll see how that goes. Um, I've had cataract surgery on both eyes at the age of 50. I had sugar cataracts, which apparently one in every 100,000 uh, cataract surgeries is sugar cataracts, which I don't recommend for anybody either because it gives you a lot of rainbows, especially when you're night driving. So I had almost quit driving at night because of the rainbows from the headlights coming at me and the rainbows and the circles. And so since they took the cataracts out, I haven't had that problem. They told me that uh, when they changed the lens and put in an artificial lens, that I would not, my vision wouldn't keep fluctuating, which it does when your sugars go up and down. And that was a lie because mine still fluctuate when it goes up and down. They said it shouldn't because of the artificial lens, but something sure makes them go crazy because I really get fuzzy when they're high and when they're low. So, and I can't tell if I'm high or low anymore because I've lost that ability. I lost that probably 30 years ago. I can't tell whether I'm high or low. Everybody that's around me said when I'm low, I get real quiet, and when I'm high, I will argue with anybody. But I thought I argued with everybody anyway. Anyway, um, that's about all I can think of. If you have any questions, or if you think of something that you want to know about, um, leave me a comment. I always read my comments and I always get back to people. If you'd like to have a video on something, leave me a comment and I will make a video about it if I have the ability. And on that note, I guess I will tell you good afternoon and have a good rest of your day.